The amendment is not adopted. The senator from Plymouth and Barnstable, Senator Moran, has filed an amendment which the clerk will read.
Amendment number 23 by Ms. Moran, damages for artificially hiking drug prices.
The senator from Plymouth and Barnstable, Senator Moran.
Thank you, Madam President, and through you to the members. I rise today in support of Amendment 23. For too long, pharmaceutical companies have played fast and loose with the health and economic security of our constituents, and our communities have been paying for it. From 2018 to 19, Medicare spending for prescription drugs grew by 7.6%, nearly double the average price growth across the country. Approximately 30% of commercially insured adults in Massachusetts who have difficulty paying for their medical bills cite prescription drug costs as the reason. Even worse, many people in our state are forgoing necessary medical care, including obtaining prescriptions, because of the cost. These aren't just big numbers or policy trends. These are people's lives. This is about the parent fighting the insurance company because their child's insulin price just jumped up without explanation, or the young employee deciding not to schedule the doctor's appointment, worrying that the medication prescribed will just be too expensive and they need to pay rent on time this month. This is about grandparents refusing treatment because they just don't have enough to pay the cost of their medication. This amendment ensures that people most harmed by these companies can act to save themselves. They, the consumer, the person directly experiencing the rising prices, can act as an enforcer where pharmaceutical companies do not meet their obligations under the law. Further, if a company takes medications off the market with only a profit motivation, the amendment will ensure that they experience at least some financial damage, representing a small fraction of the harm they impart on the Commonwealth's consumers. Life-saving and sustaining medications are often too expensive, and the price is unfortunately set according to profit of the company at times, and not the benefit of the patient or to society. We live in a state that's a leader in biosciences and innovations. We are home to many of the COVID vaccines, pulling us out of the pandemic, but the collective value of these contributions is limited when so many of our neighbors cannot get the medications they need. I'm proud of the work we're doing today. I'm grateful to you, Madam President, and my Senate colleague, the lady from Arlington, for prioritizing the Commonwealth's health. We're talking about significant steps forward for a more transparent and affordable system. I look forward to continuing the work of making the healthcare system work for our constituents, and at this time, I ask unanimous consent to withdraw the amendment.
Senator from Plymouth and Barnstable, Senator Moran, has asked no objection